Namaste. My humble pranam at the lotus feet of Lord Dhanvantari on this auspicious day of Dhanvantari Trayodashi, and my warmest regards and wishes on this auspicious day. May Lord Dhanvantari bless each and every one of us for a good health throughout our life. So this year, on the occasion of National Ayurveda Day, which falls on tomorrow, actually 23rd of October 2022, All India Institute of Ayurveda has raised a slogan, Har Din Har Ghar Ayurveda, every day, every home Ayurveda, with the aim of creating awareness of Ayurveda for holistic health. So this is the main motive of National Ayurveda, or motto of National Ayurveda Day, that let Ayurveda reach every home, every day. It's a very beautiful idea. The concept as it is really good, because we know that mainstream medicine still in India is modern medicine, and it being Ayurveda, a system of medicine of India also, people are having a lot of inhibition in employing Ayurveda as mainstream medicine. So this is one main thing which is to happen in India, especially in India, I would say, to begin with, because Ayurveda is to be the mainstream medicine of India, and it deserves to be the mainstream medicine of India. There is no doubt in that. So what is this holistic health? So it is for creating awareness of Ayurveda for holistic health. As we know, holism, the term as such, is first coined by Christian Smithson. He is a military person, and it refers to something which is opposite to analytic reductionism. When you are analyzing the whole into different components, and you are studying different components separately instead, and when you consider the whole as a sum of these different components, there is lot of reductionism, because human body as such is working on the whole. That's why Alexis Carrel, the Nobel Prize laureate in medicine, told once that man, unlike a machine, is primarily simple but secondarily complicated. Man looks very simple from outside, but inside he is highly complicated. So it is very necessary, complicated in the sense man is a highly dynamic creation. We cannot calculate precisely everything, because he is changing, he is getting adapted. Every cell in his body is getting adapted to external environment, the changes which are going on happening in the external environment. So adaptation process is going on inside the body of every human being, and so he is considered as dynamic. So this dynamic human being, how he has to be handled in the case of a disease, or if something happens deviated from the equilibrium, how to bring him back to, how to restore the equilibrium of health. Health as such is an equilibrium of normal structure and functioning of all the cells inside the body on the whole. So it refers to physical well-being, mental well-being, spiritual well-being, social well-being, familial well-being, whatever it is. Inside, primarily, man on the whole has to be healthy. That is the concept of holism. Holism does not merely mean mental, physical and spiritual connection. It also means the connection, the subtle, most complicated connections between every cell in the body, every organ, every tissue, every organ, every system in the body. So it is having very deep, subtle, most connections. So it is really important for a person to be estimated with regard to holism and not with regard to analytic reductionism. And Ayurveda as such is such a science which explains these subtle, most intrinsic connectivity between working of different tissues, structures and organs in the body. And when something goes wrong, what initiates the mechanisms of going wrong, how it is proceeded, what is happening in the pathogenesis, cause mechanisms initiating as well as ending cause mechanisms responsible for a disease. Everything is explained in the science of life, Ayurveda, or science of human being, Ayurveda. It's not like analytical reductionism, dividing into systems and explaining, even though for the purpose of easy evaluation, for the purpose of deep learning, we are also having Ashtangas, Kaya Bala Graha Urdhvanga Shalya Damshra Jara Vrishi. Ashtangas, 8 disciplines are mentioned. But that doesn't mean that Ayurveda specialist means, for example, Shalakya specialist has to handle the cases of eyes with treatment intended for eyes, or treatment intended for head, or treatment intended for ears. It's not like that. When a patient is coming with earache or ear pain, it is the duty of every physician of Ayurveda, irrespective of his speciality, to explore the cause mechanisms behind that disease, why he is having that disease. So it is really important. And another thing, just imagine the working of a car. A car is running. Suddenly it stopped running. It went halted. So the driver is not able to know why the car has halted. There can be several reasons. So if he decided that it is because of less fuel or no fuel that the car has halted, he is first going to a nearest petrol station and by walk, and filling petrol in the car and checking whether it is able to run. Still it is not running. So he understands that it is not by less fuel that it is happening. There can be several reasons. Sometimes it can be punctured tire, or sometimes it can be an engine problem. It can be anything which only a mechanic of the car can easily understand and handle. That is the case. In the same way, in human being also, even though any disturbance may manifest as signs and symptoms in the body, as signs and symptoms, sometimes pain will come, sometimes indigestion will come, sometimes hypersensitivity like features. It can be like continuous sneeze or asthma, or it can be continuous itch, sudden onset of continuous itch, severe intense itch on a part of the body or all over the body. Like that it is coming. What is to be done? It is important that Ayurveda emphasizes upon the holistic approach of handling every sign and symptom in the body, and not by mere symptom suppressants. There is nothing called anti-ing drugs in Ayurveda. There is no anti-ing drug in Ayurveda. Nothing to block, mask, neutralize, etc. It's not possible to mask or block or suppress. Many people ask me, why there are no painkillers in Ayurveda? Is it not because Ayurveda is not advanced? In the modern age, there are so many conditions which cause pain in the body, different parts of the body. It can be by trauma, it can be by inflammation, it can be by it can be sometimes by malignancy or a neoplasm or a tumor. It can be by obstructive reasons, whatever it is. Why don't you have painkillers? Without painkillers, how do you manage pain? See, this is one main thing which is required today. People are having so much pain in different parts of the body and they are running all over. Knee pain, hand pain, shoulder pain, back pain, everywhere pain. So why you are not making painkillers? We are not making painkillers because our science is insisting very strongly not to block pain. See, painkillers are intended to block pain. But our science is strongly insisting us to identify cause mechanisms immediately and reverse the pain. So our responsibility is, that is the uniqueness of holistic science. Holistic science means it is enabling the patient to take responsibility for his disease and healing. That is what holistic science is. Patient has to be made responsible for his disease as well as his process of healing. Actually, healing happens from within, innate capacity of the body, because disease is produced naturally, right? Pain is a symptom. Pain happened only because of some natural reasons. So pain has to be reversed by resolving the same natural cause mechanisms responsible for pain. So a physician of Ayurveda must immediately, it doesn't require weeks, months, days, years, etc. to identify the cause mechanisms of pain for a learned scientific practitioner of Ayurveda, provided he is learning science-based medicine of Ayurveda. He should be able to apply the principles of diagnostics, he should be able to apply the principles of therapeutics, and wisely, judiciously integrate both to reach a conclusive diagnosis and immediate decisions for reversing the problem or resolving the problem. So once he starts doing that, once he decides what to do, the role of the patient has to be educated. This is one important thing, crucial thing, which is crucial component of holistic science of Ayurveda, education of the patient. Nowadays, that is what is lacking in medicine. See, if you are blocking pain, if you are just blocking the pain sensation, painkillers, they are blocking a substance called prostaglandins, which are released during inflammation. Generally, pain happens as inflammation is existing. Inflammation means swelling in the tissues. It is a healthy immune response against pathogen or some toxin or some adverse factor in the circulation. So suppose the pain is because of inflammation in the joints or in the muscles or in the stomach or in any of the tissues in any part of your body. Suddenly the first signal of your body will be pain, sudden shooting pain. So when you are getting sudden shooting pain in any part of your body, you must understand that it can be by means of inflammation or it can be by means of obstruction, blocking happening somewhere. Only these two causes can cause sudden shooting pain in your body. So a scientific practitioner of Ayurveda, if you are going to, he or she should be able to explore what is the mechanism responsible for this pain in your body. If it is by inflammation, the nature of pain, when the pain is increasing, whether it is increased, what were you doing before that pain started? Were you doing some exercise or were you taking rest? Did the pain happen in the early morning when you woke up, or did the pain start after you exercised or while you were exercising, in the middle, or while you were sleeping? When did it start? What did you take? What diet and drinks you have taken just before the previous hours? What kind of drinks you have taken? What kind of diet you have eaten? Did you take any other medicines? Whether you have applied oil on your body, whether you were having any other sort of diseases like any infective fevers, viral fever, because inflammation is a generalized or localized fever. Fever itself, fever mechanism is happening in inflammation also. Same. So a person who is having viral fever or any infective fever, he can have body pains, shoulder pain, joint pains, aches, which were not present on the previous day, right? And also he may be getting weakness. Weakness means patients are to be educated when weakness develops. Why I am getting weak? So this is what holistic medicine is intended to teach the society. Every sign and symptom means, what you should know, what the society must know. If you are getting weakness on a fine morning, you are not having any weakness since yesterday. Today you are having weakness. You must think, what did I eat yesterday? Did I eat a heavy diet? Did I eat a rich diet? Did I take alcohol? Did I do any other? Did I resort to any other additives? Did I eat heavily? Was my digestion improper on the previous day? Next day morning, apart from weakness, what other symptoms I am having? Whether I am feeling fresh? Am I feeling fresh and active? Or am I feeling weak? Do I feel to lie down? Am I feeling tired? Is there heaviness in my body? Am I feeling lethargic or weak? And how is my bowel movement? Do I feel to go to toilet? or is there any abnormal feeling, weird feeling in my gut? And if I have a bowel movement, is it constipated or is it normal? And whether the stool is sinking or floating. When you are having inflammation, your metabolism in the cells will be weak. So your stool can be sinking. Healthy stool will float. As per Ayurvedic science, there are scientific parameters to estimate stools, nature of stools. So a healthy, well-digested, metabolized stool will be floating. So if you find the stool is sinking, it can be by excess overeating, it can be by heavy nature of diet, means based on nature of food also, Ayurveda explains foods. It's not based on nutrition alone that Ayurveda estimates diet. Ayurveda is a science which estimates subtlemost components of diet and drinks also. Okay, so the nature of diet also, how it is interacting with human beings in health, that is explained in Ayurveda. So for example, poha. Poha is a heavy food. You may think that poha is light. No. Heavy food in the sense, heavy to digest food. So when you are taking heavy foods or by nature, so too much cheese, slow digestion foods, etc., or meat, non-vegetarian foods, slow to digest, slow to metabolize. If you are habituated to it, maybe your stool can float, provided you are doing exercises, you are doing a very good healthy lifestyle. Otherwise, your stool can sink also. So if stool is sinking, it means that you are having some sort of impaired metabolic status in your body. So these things are to be educated first. And if these things are there, you are getting pain also. If you are having headache, you must be thinking, instead of applying Vicks or balm, you should not be applying Vicks or balm when you are having headache. Why, I will tell you. If you are having headache, you must understand why you are having headache. It's not that you should be eating painkillers. Har din har ghar Ayurveda. If you are keeping paracetamol, if you are keeping anti-worm, anti-helminth tablet, if you are keeping anti-hypertensive, if you are keeping anti-thyroid, if you are keeping anti-diarrheal, ORS and other drugs, then how can you say that you can emerge har din har ghar Ayurveda? It's not possible, no. You should be having some common sense to understand why I am getting sick. Because sickness is created by you, yeah, not the doctors. Sickness is created by you. So you should take responsibility in your healing process. So when you are getting headache, you must first think whether I am having any cold, whether I am having heaviness here. When I bend down, am I having heaviness here, here? These are all sinuses. Okay, maxillary sinus is there. Any heaviness is there, fullness is there. Then you should understand that it is because of sinusitis. Sometimes you may have running nose. Sometimes you may not be having. Sometimes behind head also pain can come. So this means that you are having inflammation by infection. In such a status, if you are applying Vicks, balm, etc., it can trigger the infection. It can trigger inflammation. If you are inhaling with eucalyptus oil or Vicks or something, it will inhalation of oil. It can cause inflammation worsen, for which scientific cause mechanism explanation is available in the science of Ayurveda. Ayurveda is not like I am using herbal toothpaste, I am using herbal soap, I am using herbal shampoo, so I am using Ayurveda every day. No, it is stupidity. It is blunder. If you use Ayurveda things every day, those market people claim it is Ayurvedic, it doesn't mean that Ayurveda is there in your home. Okay, if you want to implement Ayurveda in yourself and your family members, first thing what you should have is Ayurvedic common sense. Common sense in the science of Ayurveda or science of life, which I am trying my best to educate you. So when you are having a headache and you are not feeling well, you are tired, let's come back to the same point. Sip some hot water. Don't apply anything on your head. Don't apply anything. Just sip some hot boiled water. Why boiled water? I'm drinking RO water. Do you know that RO water is not pure? I know that RO water is pure. But boiled water and unboiled water are having different properties. And this is very precisely explained in the science of Ayurveda. Okay? So for us scientific Ayurveda practitioners, RO water and boiled water are entirely different things. And we cannot allow unboiled water, even RO or whatever it is, in infective and inflammatory conditions, even in healthy situation. Also, why? Because it is difficult to digest. Metabolism can slow by this unboiled water. It's not the problem of RO, okay? You can take RO water and boil, whatever you wish. You can take well water and boil. It's not the problem of RO, it's the problem of not boiling that makes it heavy to digest, heavy to metabolize, etc. So the first thing what you have to do is stimulate your digestion in headache. Okay, stimulate your digestion in headache, stimulate your metabolism. For that you have to drink hot water, sip hot water, not too much, sip hot water. If you want to inhale some steam, you can do with, there is an Ayurveda medicine called Rasnadi Churna, or even dry ginger powder. Dry ginger powder or Rasnadi Churna, whatever it is, you can boil it in water and you can inhale the medicated steam. If you are feeling congestion in sinuses, you are feeling heaviness in head, you are not feeling fresh, active, body pain is there, weakness is there, congestion you are feeling in the head, I mean sinus area, you can do steam inhalation, you can drink boiled water. Don't add any, don't put any herbs or other things in this water. That's what I am telling you. For drinking water, if you are using wrong spices, I know nowadays as a part of COVID, people are drinking so many spicy waters. My God, turmeric, ginger, chili, pepper, lavanga, what not. People are drinking so many spicy water. Even I know people who drink turmeric water regularly. It's very, very dangerous. Don't drink any medicated water without the suggestion of a scientific practitioner. Please don't do that, concerned of your health. That's why I'm telling this. Please don't do that, because every herb and spice in your garden is so powerful and potent. It can disturb your metabolism. It can disturb your circulation. It can impair your digestion. It can impair any of your physiological process and even pathological process if it is active in your body. So don't use any herbs or spices by yourself. This is number one point. And if you are having congestion, you drink hot water stored in the flask. That is best. And consult a scientific practitioner for better first aid options. First aid options. Right now, SBEBA, I am the co-pioneer of science-based, evidence-based Ayurveda. As many of you are knowing, we have formulated a Hastalamba viral fever first aid program. It's a free first aid program, online consultancy program, open to people all over the world. All over the world. Anybody can register in this at the time of viral fever or any infective fever. There is a very expert panel of doctors and volunteers trained by us who are taking care of patients, and they make sure that patients are getting well in not more than a week without any medication. That's really important. Without a medication. We are asking the patients to stop all the medications. If they are using modern medicine or homeopathy or Ayurveda, we are asking to stop all the medications, and we are giving medicated water advice with scientific nutrition schedule, which we have designed to reverse infective fevers for the first time in the history of Ayurveda. So this SNS, scientific nutrition schedule, we are advising the patients and we are ensuring them. Our expert team of doctors are calling through volunteers. They are getting information of the patients morning and evening, making sure that patients are getting well. So this is possible. Even people who are having high pneumonia, people who are having oxygen deficiency, all stages, mild, moderate, severe, we don't care for COVID, because there is no COVID in Ayurveda. We have infective fever guidelines. We care for host factors, not the pathogen factors. Whatever pathogen is there in our body, it is always we are full of pathogens inside and outside. So how can we make sure that there is no COVID virus in our body? We cannot be always make sure that there is no COVID virus in our body or any other virus, any mutant virus or bacteria is there. Always many pathogens are there. So what we should do is, we should enable our innate immune system's efficiency to eliminate infection from the body. Suppose we get a healthy immune response against the pathogens, it is what is called infection. So infection is not something which is to be feared. It is a friendly, healthy immune response to protect you, to eliminate infection. You are getting infective fever to eliminate infection. So you should be knowing, see, you should be knowing, we must know, we are learning science, we are supposed to know Ayurvedic science, how we can reverse infection without medicine. That is our primary necessity, professional necessity. But public these days, I deeply wish Government of India should initiate Hastalamba VFFA in all the public health program in connection with viral fevers or whatever infective fevers. It's my humble most request to our Honorable Prime Minister Narendra Modi ji, because once it is taken up as the mainstream prevention and curative strategies of infective fevers in India, I am very sure there will be no further mutations, there will be no hospital admissions with calamities, what you call casualties, more and more casualties, oxygen deficit, emergencies, ICU admission, etc., will not happen. The necessity will cut down dramatically if SBEBA VFFA, viral fever first aid program, is implemented by central government and state governments. So we are doing such a program, we educate the patients. So education is really important. People should be knowing, you should be eating what, you should be drinking what, you should not be taking unboiled water. Okay, I am feeling so weak, let me go and take a bath. No, you should not be taking bath if you are feeling heaviness in sinus, if you are feeling congestion in sinus. Some patients tell me that I have to go to doctor, I have to come and see you, no, so I should look smart. What is the point of looking smart if you are having active pneumonia inside your lungs? There is no point in looking smart externally when you are sick internally. So it is really important to know that when you are having infective fever, when you are having congestion in sinus, when you are having congestion in lungs, you should not be doing any water application on your body and head. You should not be doing any oil application, balm application. When you are getting sudden pain in your body, whether it be abdomen or chest or back, first thing what people do is application of oil. Don't do that. It can be by inflammation. Even heart attack is caused by inflammation. Okay? Even though it is obstruction, it is an inflammation of the heart. So if you apply oil on the chest and give some fermentation, etc., it is very dangerous. No doubt it's going to be a very fatal consequence. So don't apply anything on your body or head when you are having oil. When you are having infection. But you can apply dry heat. Dry heat in the sense hot water bag, or you can apply even heated cloth without wet. Dry cloth, heated dry cloth in painful regions. And you can reverse the pains. So aches and pains, if you do like this, it doesn't take more than a few hours or minutes to reverse the pain. And when you approach an SBEBA practitioner, we can understand the real cause of pain by estimating your immune status through blood test, basic blood test. Basic blood test. We don't want to do COVID test and all. We don't care also. We want to estimate the blood immune status through basic blood test. Immune cells, we will be able to understand from that basic blood routine test. Total count, neutrophil, leukocytes, C-reactive protein, certain inflammatory parameters in the blood. All these will give us important clues Even modern medicine doctors are neglecting that. I have seen many patients where infection and inflammation has escalated to a very high level. And these specialists, I'm not blaming blindly, just because I have seen prescriptions, I'm telling that it is a fact that these physicians are prescribing painkillers, endless painkillers, without analyzing the cause mechanisms. Even immune status is not analyzed, whether it is by infection that the person is having headache. Nobody knows. Just simply some cetirizine like medicine or some painkillers are prescribed. So this is not the way. In Ayurveda, you cannot expect to attain any painkiller prescription. If you are finding some doctor is prescribing painkiller, understand that he is not having genuine knowledge about the science-based medicine of Ayurveda, irrespective of his qualification and experience. This is the fact, because unfortunately, science-based medicine education and training is not happening in today's curriculum of BAMS, MD and PhD. This is not happening. We are learning science, but we are not trained, professionally trained regarding how to apply science of Ayurveda in various clinical situations. For example, how to understand an infection, how to understand an inflammation, how to approach an inflammation, how to reverse an infarction or myocardial or any other infarction, whatever it is, how to reverse a stroke. Suppose a patient comes with stroke, sudden severe headache, one-sided paralysis, weakness, unable to swallow, salivation is happening. What to do immediately? Ayurveda doctors or students are not getting any training. Then how can you expect them to handle such cases? So science-based, evidence-based Ayurveda has first started. We have started such kind of precision medicine-oriented curriculum. I mean curriculum in the sense we have 5 publications regarding all these. And we are giving training to doctors through our CMEs and workshops to all parts of India, physicians. So we have no support from government. Otherwise, this should be taken up by the government. Then only Ayurveda will be projected as professional Ayurveda, intended professional scientific Ayurveda, where science-based medicine is professionally practiced, trained, educated and researched. This is the need of the hour. Headache can happen by constipation. Headache can happen by dehydration. Do you know? Headache can happen by dehydration. If you are not drinking enough water, headache can happen. Some patients will come and tell, doctor, my headache, when I got headache, I checked my BP and it was high. So it is because why your BP is high? Headache is because BP is high. Okay, I agree if it is like that. But why your BP is high? That I don't know, doctor. I am taking BP tablets regularly, but sometimes it goes high and sometimes it goes normal also. So why BP is high? See, in more than 90% of BP cases, essential primary hypertension, which is called in modern medicine, they do not know why it is happening. What is the cause of raised BP? Modern medicine does not know. But they are giving medications to suppress the end mechanisms of BP. Why BP is raising? Cardiac output and peripheral resistance. Heart is pumping more. So they will give medicines to reduce cardiac output. They will give medicines to reduce peripheral resistance. So like that, end mechanisms are manipulated, trying to suppress BP. That is what is happening. But most of the patients are having BP still while they are on anti-BP drugs. But that is not the case of holistic science of Ayurveda. We are exploring the patient. We are asking many questions. History of the patient, lifestyle of the patient, what kind of diet patient is taking. Nowadays there is a trend, for example, to avoid all the fats. To avoid all the fats in the diet. Eat a very dry diet, dry fiber rich diet, sprouts, eat so much of uncooked vegetables, eat so much of fruits, drink so much of tender coconut, like that. Two extremes of people are there now. One extreme of people will be continuously fast food culture. They think that anything can be resolved by suppressant medications. They think that it is nectar. When you get pain, take painkiller, yeah. When your kidney gets damaged, go to nephrologist here. When you need replacement, go for replacement here. This is the policy. One team. Second group is always very health conscious. They will not take any oil, ghee, butter, cholesterol may increase. They will take dry foods mostly. They will take uncooked vegetables, fruits, and uncooked cereals, sometimes semi-cooked rice, semi-cooked wheat, fiber-rich diet. Nowadays, oats is a trend. In my childhood, it was rice and wheat only in India. But now I see oats. People are using so much oats in their diet. Fiber-rich, thinking of fiber content. So like that, people are eating heavy to digest. So, based on the nature of food, fibers are heavy to digest. So you will feel filled very easily. That is true. But the problem is that too much dry food, too much heavy to digest foods, filling the gut, too much roughage in the diet can cause impaired circulation. It can affect cardiac circulation. It can affect cerebral circulation slowly. And it can cause raised BP also. So this is, people will not know. This is explained rationally in the science of Ayurveda. A person who is studying Ayurvedic science seriously in the professional curriculum and learning science-based medicine of Ayurveda can only understand this. So in your case, suppose you are having essential primary hypertension, raised BP. We will be asking your history, whether you are doing excess exercise. See, exercise is a very important factor. If you are exercising over food, after food, food may take 3 hours to digest, minimum, normally. But if you are doing exercise after food within 3 hours, if you are not doing exercise in empty stomach, see, that is heavy working load to heart. It can increase BP. You are not knowing. You think that you are doing very good exercise. Wow, I am very health conscious. But when you are doing exercise, and how much you are doing exercise, what kind of exercise you are doing. For many people, walking is not enough. Metabolism is very slow. Anti-aging drugs have further impaired the metabolism. See, anti-aging drugs are an adjustment mechanism. So when anti-aging drugs are prescribed for cholesterol, diabetes, BP, etc., it can further impair digestion, metabolism, circulation, etc. And it can further weaken the metabolism. So in such a case, if you are undergoing wrong diet and regimen, even postural exercises, people are focusing more. See, don't misjudge my words. I'm not against yoga. I respect yoga and other alternative sciences. Don't misinterpret my words. But if you are doing postural exercises in inflammatory status, suppose you are having inflammation in muscles, joints, anywhere, ligaments or any tissues, you are doing, or in abdomen or in heart or in kidney, wherever it is. Suppose you are doing yogic exercises, therapies, it can adversely affect you. Okay, and if you are having hypertension, I suggest that BP has to be normalized by its cause mechanisms. And then yoga can be practiced as a healthy habit. No problem in that. But exercising, like what kind of exercise? People tell that they are walking, they are doing yoga, etc. But that is not enough. Sometimes that can be wrong also. So which only a scientific practitioner of Ayurveda can understand this. What kind of exercise you should be doing. Whether your body is intended for exercise. If you are having rheumatoid arthritis and other problems. You are not intended to do exercise if your inflammation is very high. First of all, we have to reverse the inflammation. For that, scientific treatment principles of Ayurveda, science-based medicine has to be adopted for perhaps 1 week to 2 weeks. If your disease is too chronic, maybe 1 month also to 2 months. First stage, we have to reverse the inflammation. Then only we can do exercise. And at the same time, you are not intended to take rest also. Nowadays, rest, drink water, take fluids, close from everywhere, sit inside the room. That is what they are telling. Infective fever protocol. It is wrong. When you are having infective fever, you should not rest. You should not be resting on bed. If you are resting on bed, you will sleep also. What happens is, metabolism will further slow down. Metabolism in the cells is an active process which is intended, which is initiated by the immune system to destroy the infection and the pathogen. And if you sleep in the daytime during infection, metabolism will further weaken. Your immune system will not be that much efficient to ward off the pathogens. So you have to sip hot water, you have to sit up. I don't mean that you have to do exercise, okay? But you should avoid sleep. You should avoid continuous lying down unless you are that much weak. That much weak. If you are that much weak also, you should sit up on your bed, sip some hot water, medicated water prescribed by your scientific practitioner of Ayurveda. You have to get up and go to toilet instead of bringing this basin to the bed. You have to try to get up and walk, because when you are moving around, your metabolism is getting stimulated, and that helps your immune system to eliminate infection easily. So this is what regarding diet, exercise and other factors. And during infection, your BP can raise. Nobody knows all this. During infection, your blood sugar can raise. And the medications for blood sugar prescribed by, infection prescribed in modern medicine. Many times, immune suppressants, steroids, they can increase your blood sugar. But what science-based medicine of Ayurveda, SBEBA is doing, suppose a diabetic patient comes to us with viral fever. What we do is, we take care of viral fever first. Because viral fever, if it is not reversed, immediately it can go to pneumonia. It can progress to bacterial stage. It can go to pneumonia. So we have to reverse infection. And the strategies which we are adopting in viral fever, with or without medication, is stimulating the metabolism. The same metabolism is taking care of diabetes also. So his blood sugar will come down, he will feel more active. So along with his recovery from viral fever or infective fever, let it be bacterial or whatever it is, he is getting rid of his diabetes also. 2-in-1 benefits. So we are not doing any magic. This is the magic of science. This is the accuracy of science. Science advocates this. So we are doing this. There are specific logics. We have published all our logics in our 5 publications of SBEBA. You can go to our website, but it is not for public mostly, but there are 1 or 2 publications open to public. Others are meant for scientific, qualified practitioners of Ayurveda to study and understand and undergo training in science-based medicine. So each and everything what you are doing in your sick status, indigestion, infection, you have to stimulate hunger. You have to wait till you get hungry. Don't eat by thinking that, oh my God, I am very weak, I should be eating something to make myself active. No. If you are not feeling hungry, if you are not feeling active, you understand that it can be by less drinking of water, or it can be by infection, inflammation or indigestion. 3 I's: infection, inflammation, indigestion. Weakness main causes or infarction. Heart attack can also cause weakness. Okay? Infection, inflammation, indigestion, infarction. Infarction means cutting of blood supply to tissues in the brain or heart. So it can cause weakness. If you drink ORS, or if you drink milk, if you drink lemon juice, sour things, every taste, there are 6 kind of rasas in Ayurveda. Every rasa, madhura, amla, lavana, kadu, pungent, tikta, bitter, kashaya, astringent, all these rasas in the food can cause impact in your body, in your digestion, in your metabolism, in your respiration, in your circulation, every process, especially when you're sick. When you're sick, what you eat determines how fast you recover. This people do not know does not mean that such a science is not there. Okay. So when corticosteroids are the only way for autoimmune diseases, that is for modern medicine. Public must know this fact. When they tell that, wow, knee replacement or joint replacement is the best treatment in osteoarthritis, you must understand that it is the opinion of Western medicine here. Don't confuse yourself. When you consider one medical system authentically claiming that they are having the best treatment in their system, this is the best treatment option available for this disease. You understand that it is their opinion. It is the opinion of that system and not the opinion of a universal doctor. Okay? Who is a universal doctor? A universal doctor is the one who is efficient and capable to handle human being on the whole. Handle human being on the whole. Suppose a patient with heart attack, a patient with rheumatoid arthritis develops heart attack and viral fever. A physician is telling, I can take care of all the three of you. Just give me some time. I'm not asking for many days and months. Just give me some hours, some days to stabilize. I can do with the principles of my science. Just allow me to do. Follow me correctly. Follow what I'm telling. Follow my science is telling some principles. I'm educating you that principles. If it is your responsibility to heal, it's my responsibility to treat only. It's your responsibility, your own responsibility to heal yourself. If you are not ready to heal yourself, go away. You are having other options. You can go for replacement, you can go for painkiller, blocking, masking, suppressing. So many options are there where you can eat anything, everything and undergo the risk, whatever it is. But I don't know such adjustment treatments. I call it as adjustment more than treatment. If you want treatment, there is only one science which advocates treatment. And that science should be holistic science, which is capable to handle man on the whole. We cannot cut man into pieces and treat. Inter-department transfer. Suppose a patient gets a headache, ENT is taking care. That time he gets acidity, gastroenterologist is taking care. That time he develops some heart pain, he is referred to cardiologist. It's impossible. You will get medications, but you will not heal your body or your disease. So this is what holistic science means. Holistic science doesn't mean spirit, mind, body together. That is only one aspect of holism. Nowadays, lot of misinterpretations are happening on Ayurveda as spiritual medicine. It's going to a very worst, detrimentally worst level. We are taking care of the soul. We don't need to take care of the soul. Soul doesn't have any expression. Ayurvedic science itself tells nirvigara. Soul does not have any vigara. Our main objective is to take care of the disease of the sick patient and take care of the health of the healthy patient. So these prime objectives can be met only by adopting the principles and practice of science-based medicine. There is no meditation. I'm sorry, some connection problem happened. Let's continue. I hope I'm visible and audible to all. So there is no spiritual medicine, healing, let me read out. I have written Tridosha balancing diet. Complete stupidity. You cannot balance any Tridoshas by any diet. Okay? Tridoshas are the functional classification of structures in your body. Every cell has got Tridoshas. Okay? And they are undergoing their own functions in the body. And there is nothing to do balancing of Tridosha by some diet and all. It's not like that. It's foolish. Detoxifying herbs. It is not Ayurveda. Ayurveda is not detoxifying herbs, rejuvenators, Ayurveda nutraceuticals. This is another funny thing. Everything Ayurveda Ahara. What is this Ayurveda Ahara? Mixing medicine and food sometimes and making candies, Thali's candies, Chavanaprasha candies. How foolish it is. You are distorting a brilliant science by doing that. You cannot do that. You have no rights to do that, those who are doing it. They should understand that Ayurveda is science-based medicine. And food and medicine are working by different principles. The working of food in the body is different from working of medicine in the body. Pharmacodynamics is different. So how can you convert a medicine into a food? It's not possible. Food you can convert into a potent healing power. You can induce in food by appropriately modifying the ingredients in according to cause mechanisms of diseases, which a scientific practitioner can do according to the state and stage of the patient. Right? We cannot universally tell like what you call shimbi dhanya, pulses, sprouts and sprout diet, sprout paisa. All these are completely stupid. There is nothing called Ayurveda. There is nothing called, you are finding so many recipes now, advertisements. Ayurveda does not advocate in the name of God and my science. I am a very honest physician. I don't want to do any show off here by telling something and not taking responsibility for my words. I am ready to tell this to any person, any authentic person concerned. It is wrong. It's not proper to advocate Ayurveda. There is nothing called Ayurveda. If you want to implement scientific nutrition, you can implement that to the specific subject if needed, according to his disease condition. How he can eat, what all ingredients he has to avoid till his pathology gets reversed. And how you can stabilize his health. That also can be explained. It's a very fast process. Pathya means scientific nutrition, compatible, strictly compatible to the digestion as well as the pathology inside his body, the abnormality inside his body. So it's for a specific period. After that we can educate the person, these things in your diet, if you continuously practice without any control, it can raise the same pathology. So you must undergo the same diet, which I advocate you every month for 5 days. Repeat 5 days disciplined diet every month. Then your body naturally will withdraw itself from causing that pathology eventually. And also you can stimulate your immune mechanisms by doing exercise, by stimulating your hunger, eating only when you are hungry, drinking boiled water and managing each and every disease properly. That's what I am asking. How Har Din Har Ghar Ayurveda possible when you are taking paracetamol in fever? It's not possible, no. If you are using herbal toothpaste or herbal soap, it is not Har Din Har Ghar Ayurveda. For making Har Din Har Ghar Ayurveda, wisdom of the people has to be awakened. So what kind of habits I should make when I am sick? So my humble efforts were only regarding that only. And another regarding memory, concentration, etc. People are eating so many Ayurveda medicines. And another interesting thing, herbal tea. Herbal tea, it's useless in Ayurveda. I mean, herbal tea is useful for many other disciplines. I don't want to comment on it. In Ayurveda, there is nothing called herbal tea. Please understand that. And herbal tea is not healthy in Ayurveda. If you are a patient, hypertension, suppose you are having BP, if you are taking tea with licorice, I mean, Yashti Madhu, Glycyrrhiza glabra, it can increase your BP. If you are drinking pepper tea every day, it can also increase your BP by increasing dehydration in cells. There are many people who eat turmeric every day. Turmeric can cause dehydration in your cells. It can even cause heart attack or stroke in you. Please understand, these are not silly things. You cannot make any sort of decoctions and drink by yourself and call it as Ayurveda. You can do it at your own risk and consequences, but don't call it Ayurveda. Ayurveda is not grandma's medicine. Ayurveda is not kitchen therapy. Ayurveda is, you cannot see, every person has different experiences. For me, I use eucalyptus oil, it works. That is not Ayurveda. Eucalyptus oil may work, may not work. That is not Ayurveda. I have used this thing, I have used that thing. It is only experience. Experience-based medicine is not Ayurveda. Tradition based medicine is not Ayurveda. What is the difference between tradition and science? Tradition means that practice which is being continuously followed for many years, many centuries without any question. For example, I am taking one kashaya when I am having fever. My grandmother has advocated it. I am drinking that. I am telling my children also, you drink that when you are having fever. And my children, when they get children, they are transferring it. It is not science, it is called tradition. And that knowledge may be having back support of science in certain situations. But according to situation only science emerges. Science cannot be generalized. Cold, this medicine. Headache, this medicine. That is not science. Science means what, when, why, how, where, why not. Everything has to be answered by science. Science explains, gives rational reasons. What is to be done here? What is wrong here? First of all, what is wrong here? It has to be explained by science. Why I am having headache, doctor? Then I will ask you some questions. You have to answer me and I am able to explore why you are having headache. I am giving you solution. Within 20 minutes your headache resolves. That is called science. Science is having transparency. You are able to explain why, how, what, when, where, why not. And if something is not working, why it didn't work. That should be answered by science. So Ayurveda is science-based medicine, knowledge-based medicine. Science is not statistics also, okay? Data-oriented calculations, inductive reasoning, observation-oriented calculations. That is not the science intended in Ayurveda. In Ayurveda, science means scientia itself, knowledge, basement knowledge. We are having a deterministic science. We are not having probabilistic science. We are following deductive reasoning, not inductive reasoning. So we don't have probabilities as much as possible. We are having calculations. Our scientists, ancient scientists, have given us certain algorithms and clues to enable us to think what is wrong in the patient and what has to be done to rectify it as early as possible. It's very quick. Ayurveda is not slow medicine, it is fast medicine. It is the fastest medicine, I will say. And I'm doing it also. I'm ready for taking up any challenge also regarding this. Now you may ask, suppose emergency, one accident comes, so much blood loss, patient got unconscious. Come on, take up the challenge. Don't be so idiotic to ask such questions. Accidents are not diseases. Okay? Wherever emergencies, disasters happen, there emergency medicine is required. And we can prevent more than 90% of emergencies, both medical and surgical emergencies, by science-based medicine of Ayurveda. This much we will not hear this much ambulance noises. We will not hear this much rush to hospitals. Suppose government is taking up science-based, evidence-based Ayurveda. I think I have covered most of the points. First aid, just a few points on first aid. Then after that I am winding up. I think I have taken some extra time also. I am winding up. If you are getting cuts, burns, etc., apply turmeric bandage. First aid I am telling, I am not giving prescription to you. Turmeric bandage, instead of betadine powder, you apply turmeric bandage. It will heal so fast. You avoid foods that cause indigestion for 2 days. Milk products, heavy to eat, meat, oily foods, etc. for 2 days. If the wound is deep, it will heal very fast. Burns also, you can apply Murivenna. There is a medicine called Murivenna. It is available in all Ayurveda pharmacies. Burns, you can apply Murivenna. And if you are getting sudden hits on head or somewhere on the body, immediately you have to apply Murivenna bandage. Bandage with Murivenna. Immediately, not later. You should be having Murivenna at home. Immediately you should be. That will prevent hematoma. That can prevent clot formation in the brain. That will reduce swelling very fast. And you should be starting boiled water you should be eating light diet to resolve the inflammation for 2 days. Eat light, stimulate hunger, drink boiled water, etc. And if at all possible, consult with scientific practitioner of Ayurveda. And indigestion, you have to wait for digestion to happen. Then diarrhea and vomiting, there is a diarrhea and vomiting better than ORS. ORS is anti-secretory. It will only reduce the secretory activity in the bowel. But we are having a thing called Laja. Laja, you can check in fried paddy, you can check in Malara in Malayalam, you can check Google for Laja. I will share the picture also under this talk. That you boil, don't eat that. Boil that in water, about 3 tablespoons in 1 liter water with 2 pinches of jeera. And take 15 ml of hot water every half an hour. 15 ml of Laja jeera water every half an hour. And wait till hunger comes. Don't sleep, don't take ORS, don't take any medicine. This is first aid what I am telling, not medication. And understand how effectively it is working, 1000 times better than anti-secretory ORS. Because this thing will improve your digestion, metabolism, it will help to arrest the abnormal bowel movement and make you hungry also. So this is another thing which I want to okay, that's all. So finally I am concluding by telling that this what you call Har Din Har Ghar Ayurveda is a very beautiful concept. I really respect All India Institute of Ayurveda for emerging this motto, and this motto has to be realized by each and every scientific practitioner of Ayurveda by implementing in his practice. If at all possible, conduct training programs in SBEBA, attend training programs in SBEBA, educate your patients, educate your community, educate society, and just make sure that Ayurveda in its purest essence of science is reaching every home to save people. So may God bless you once again. Thank you for your immense patience, for spending time with me. May God bless you. Namaste. Hare Krishna.